Hello everyone. My name is Megan Clumpus, and today I'll be providing a brief presentation on my culminating project, analyzing models of senior physical activity programs in Ontario in environmental scan. My practicum was completed at Senior Community Services, which resides on the unceded traditional Algonquin territory of the Anishinaabe people. I would also like to acknowledge with respect the Lugnawiggin people on which the traditional territory of the University of Victoria stands. I'd also like to take this time to thank Don Roger, Dr. Jeff Masuda, and Dr. Zara Premji for their ongoing support and assistance throughout the semester and my work. First, I wanted to provide a brief introduction on the importance of physical activity as a public health issue. Both the Public Health Agency of Canada and the Canadian Society for Exercise Physiology recommend 150 minutes of aerobic activity each week alongside strength training activities at least twice a week for adults aged 65 and older. The reported benefits include, but are not limited to, improved balance, reduced risk for falls, reduced risk for physical disability later in life, and improved disease prevention. In considering fall risk specifically, falls are a major cause of dependence in advanced age and may result in long-term disability, loss of mobility, reduced quality of life, and sometimes death. Falls that may result in relatively minor physical injuries still prove to be associated with some severe psychological consequences, including increased fear for falling, loss of confidence, and social isolation. These psychological considerations may result in self-restricted activity levels, leading to a reduction of physical function and social interactions, and may therefore increase the risk of further falls by contributing to deterioration in physical abilities. Public Health Ontario also notes that falls represent the leading preventable injury and the leading cause of morbidity in older adults in the province. Fall prevention is a large public health issue as it represents both a significant cost, both economically and personally. So for my culminating project, an environmental scan was completed to identify physical activity programs being offered for seniors through Ontario's designated senior activity living centers within a 150 radius of Kemptville, Ontario. Kemptville, Ontario being the town in which the Senior Community Services Center that I worked for was located. So as a means of highlighting the current state of practice in the surrounding geographic area, summarizing the respective program characteristics, and gaining insight as to the requirements being fulfilled to receive funding from the Government of Ontario. A gray literature search plan was developed to incorporate 3 different search strategies. First being gray literature databases, second being customized Google search engines, and the third being targeted websites. The specific websites and databases can be seen there on the screen. The search strategy included 2 categories of terms: older adults, such as seniors, aged, and adults, in physical activity, including exercise, fitness class, muscle strengthening. The specific search terms were developed largely with guidance from the University of Victoria librarian, Dr. Zara Premji. As a result of the environmental scan, successful contact was made with 13 senior active living centers. Approximately 69% of the programs identified the solicitation of participant feedback as their primary evidence base, where 4 evidence models were identified through the scan, including hiring certified instructors through the Canadian Centre of Active Aging or another regulated body, recognition of the program through the Ottawa Heart Institute HeartWise program, assessing community need, where unfortunately with this evidence model, there was no clear model identified or communicated to me from these centers. And like I mentioned, the solicitation of client feedback. So the report itself provides a large overview of the results obtained from the environmental scan. However, I wanted to focus my presentation on the recommended next steps for my host organization, SCS, to establish a strong evidence base for their physical activity program and meet the criteria in order to apply as a senior active living center with the Government of Ontario. So these recommendations include completing a state-of-the-art literature review in hopes to provide a tangible model for the design of a safe, effective, and equitable physical activity program, continuing to include a strong virtual or remote component to existing programming as means to reach underserved communities with specific attention to the Francophone population, and implementing an evidence-based model through both the employment of certified instructors and conducting formal solicitation of client feedback. In addition, I do recommend that they apply for the Government Ontario Senior Active Living Center designation as means to increase funding to provide further reach to the community. And lastly, approach the Leeds, Lanark, and Grenville Public Health Unit, which is the local public health unit in that area, to be a designated facility to offer the Better Strength, Better Balance program. This provincial program is currently only offered through Ottawa Public Health, and hopefully offering this program may assist in future funding proposals, as well as it provides the opportunity to offer an evidence-informed fall prevention program in the area. It is important to consider what this work means for public health. 3 specific implications have been developed with consideration of the work by Prohaska et al. 2006. This article previously proposed specific recommendations for research priorities specific to physical activity, public health, and aging. The 3 recommendations include developing a valid and reliable measurements that can be used for provincial surveillance system, expanding research on the benefits of physical activity to include a broader range of disability and quality of life measurements, and expanding research to determine ways to increase participation and access to underserved communities. These proposals support the evidence found through the environmental scan. Unfortunately, there was a lack of specific measures that outline the most effective, equitable, and appropriate way to develop a physical activity program in the senior community. In addition, integrating a surveillance system into the provincial government would ensure fair access to all Ontario citizens, ensuring that each active living center is providing evidence-informed care. Lastly, further research is needed how to best reach the most underserved population groups as needed. Currently, the underserved populations identified in Leeds, Lanark, and Grenville include those living more remotely within the region and the Francophone population. However, more research is needed not only to identify any other underserved population groups, but determine more solutions in reaching these individuals. Thank you so much for your time today. I'm happy to take 5 minutes to answer any questions you may have about my practicum or the public health implications of physical activity in Ontario's senior population.